Hello everyone, today I'm going to be answering a question from Sadia Williams. She said, I have had surgery and now have one tube. What's the chances of ever getting pregnant again? Or what do I need to do on my part? So today we're going to be talking about what you can do to prevent a recurrent ectopic pregnancy. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. The answer to the question, yes, it is very possible for you to have a normal pregnancy even with one tube. But what can you do in order to prevent you from having another ectopic pregnancy? One thing you need to know about ectopic pregnancy is that it occurs in 2% of the population. But if you have had another ectopic pregnancy before, your chances of having another ectopic pregnancy increases to 10 to about 25%. That you have a 10 times higher chance of having another ectopic pregnancy than someone who has never had an ectopic pregnancy before. But it is possible to have a normal pregnancy after. Let's take, for example, you've removed your tubes. We know that in ectopic pregnancy, 95% of ectopic pregnancy occurs in the tubes. So there are other places where the fertilized egg can implant, but not necessarily in the tubes. Most at times, there is no identifiable cause of this ectopic pregnancy, but there are just some risk factors which are present that can increase your chances of you having an ectopic pregnancy, which includes first a previous ectopic pregnancy. The second is smoking, alcohol intake, a previous surgery to the tubes, and the most important, sexually transmitted infection. Sexually transmitted infection is the most common cause of ectopic pregnancy. Now, how can you prevent yourself from having another ectopic pregnancy? Once you have had an ectopic pregnancy, it's good for you to identify the various causes. So it's important you find out, you ask the doctor, what was the cause of this ectopic pregnancy and what can you do? A series of tests, for example, testing for sexually transmitted infections, and if it is present, then you are treated immediately so that complications cannot happen. Now, how can a previous ectopic pregnancy lead to or increase your chance of having an ectopic pregnancy? When you have ectopic pregnancy, you know inside the tubes we have what we call cilia. These cilia are what help propel the fertilized egg from the fallopian tube into the womb. Even if it is treated well, we still have some inflammations which have occurred in that tube, because ectopic pregnancy, if it's identified early, it can be managed with medications. So it helps dissolve the ectopic pregnancy in the tubes. So it can destroy these cilia. So if it happens again in that tube, therefore the fertilized egg cannot still move. But it depends how much of the cilia have been destroyed before it can cause another ectopic pregnancy. Even if it occurs on that same tube, you can still have a normal pregnancy. What can you do on your part is prevent yourself from sexually transmitted infections. If you have multiple sexual partners, reduce them, or you use condoms. That's the barrier protection method. If you're taking cigarettes, you stop smoking. Alcohol, you reduce it, especially during the time when you want to get pregnant. It's always good. You can even stop taking alcohol during that time. Then people who have had a history of tubal surgery, that's an operation on the tube, maybe you had a fibroid and it touched the tubes, those things too can also increase your chances of having an ectopic pregnancy. So one advice I'll give you is, once you are pregnant, it's always good to do ultrasound early to identify where the pregnancy is. In your case, the person who sent the comments, you have one tube left. So you need to be very, very careful. If you want to have intercourse with anybody, it's good to do your test. Screen for these sexually transmitted infections. If it is present, treat yourself and your partner, and you do a complete test after, that's a control after, and ensure that it is negative before you get into sexual intercourse. So the advice is try to reduce the risk factors as much as possible, even though most at times the main cause of the ectopic pregnancy is not seen. If this was helpful, give a thumbs up to our video and share to other women. But remember that you can have a normal pregnancy after an ectopic pregnancy. But once you get pregnant, it is good to follow up immediately. Thank you very much, and God bless you.